Hi, everyone. I'm the director for our New Zealand registered not-for-profit trust called Common Knowledge. And we're blessed to hold all of the birthing better skills that hundreds of mothers and fathers developed in the early 1970s. Back then, when I gave birth in 1970, there was a 4.5% cesarean rate, which meant all of us that had breech babies labored and had a vaginal birth. And that meant that most of us, our births were fine. Some of us, we had problems that were resolved, usually by the medical profession, using forceps or doing episiotomies. And why were they doing that? Because they can see how tight we are. And some of us, sadly, did have tragedies. And most often, because our bodies are tight and immobile. So when we, the hundreds of mothers and fathers and I, developed these skills back then, we did them for two purposes. One is so that we could cope better with the natural, normal, and physiological occurring pain of labor contractions. And second, to help this big object inside us get out safely and as easily as possible. We learned how to create space side by side between our hip bones, front to back, our sacrum being more mobile, being able to reduce tension between our sit bones, knowing exactly how to prepare the deep inside of our birth canal, and very importantly about positions, because the positions that have been advocated by the 1980s for many women don't work. Many women, when they walk, they tighten up their bum muscles, so that reduces the space and ability for the baby to move through. When we sit on our sacrum with our knees bent and feet in a semi-recumbent position during second stage, many babies get stuck and we're pushing much too hard because they need to move the sacrum and we're sitting on it. A lot of people say hands and knees, that's preferable. But really, when you look at it, we're just lying on our belly. What's the difference between that and lying on our back with feet up in stirrups? Well, the difference is that we're actually holding more tension in our body than if we're lying on our back with our feet in stirrups. Do that sometimes. See how open you are. Are those positions wrong? No. What they are your positions. And if your contractions aren't progressive with a breech baby, then that's where the risk begins to occur. Because when you don't have a progressive birth with a breech baby, it's more likely that there may be something that retards the baby from moving down through and out of your body. And this is what the course goes through. You'll learn all the skills to prepare your body to open up. Start at 24 weeks. Spend 5 to 15 minutes every few days, less time than you're spending trying to spin your baby. Then 32 weeks, 5 minutes a day to prepare your vagina. You learn how, and your partner learns how as well. You don't want any restriction. Fathers get this. Big object inside a container can't change the shape of the object, therefore change how the container responds. Open it up, make it pliable, make it able to create space to let this big object out. And then you need to learn about positions. You need to learn about progressive contractions. And this is what men saw. We didn't see it as women. We're in the experience. We only see contractions. They're either not painful or painful. Men see them as 5 phases. They start, they increase in intensity, they peak, they begin to go down, and they go away. That's a progressive contraction. But what men also saw was contractions started, they started to go up, then they plateaued and dribbled away. And that was a non-progressive contraction. And when women often get into a hands-knees position, they are backing off their labor. They begin to have contractions further apart and less effective ones because the baby is telling us, I don't like the position you're in. I can't come down through and out. So it's really important that if you have a breech pregnancy and a breech baby, that even if you turn your baby, even if your baby is head down, it's still a big object. And the reason doctors used forceps and episiotomies is they see how tight we are. And the message we are being given in the conventional childbirth conversation outside the medical community since the 1980s is women just know how to birth and their vaginas will just stretch and just leave women to discover birth. Fathers and mothers and I in the 70s onward, we took a different approach, which was it's normal and natural when you're pregnant to self-learn birth and birth coaching skills and then use them to birth your baby in all circumstances. And when we had higher risks, we became more skilled. We can't always turn our baby. We can always create space in our pelvis. We can't always assume that the position we're in is the best, but we can learn how to read babies' contractions, the messages they give us, and then get into positions that keep our contractions progressive. We can do that, and our partner can know how to do that. So we invite you to purchase this course. We are not permitted to post this link on any Breech Network Facebook page because they see it as promoting. Nada, we are. We want all people who are pregnant with breech babies to learn skills so that they have a safer birth and they can help reduce or prevent the major risk that comes from having a breech birth, which is the head gets stuck in our pelvis. Wouldn't it be nice to know how to create space so that doesn't happen? Wouldn't it be nice to create space in our vagina so that doesn't happen? Wouldn't it be nice to know what positions to get in so that doesn't happen? If you agree, then please post this everywhere you can because we need to grow a skilled birthing population, particularly for people who are perceived of as higher risk. Thank you. Thanks for listening. Bye-bye.